defined.
Like similar to the front door. Oh, it's just his. Yeah.
Great. So we're going to work to flatten everything we can on the lower border, right there, and then, which are lower stomach, right here, and then also along the hip area and the sides, known as the flanks. So that area really will make a huge difference with regards to how he looks. And here like that for a second and turn. There you go. So we're going to go along here, and now it's going to make his buttock look a lot nicer by us going through here and removing all the side fat, creating more of an athletic shape for men. He has a really nice buttock already. All we want to do, and not make him larger or anything, is just give a little bit of contouring to the buttock at the same time. All the extra amount of fat that he has in the back area, we're gonna get that out. And then up to the back, just really cleaning this up, tightening here that we can give a little more definition to as well. Now we're going to give him definition in the lateral border of his abs as well. Hey guys, it's early morning. We're in West Hollywood, and guess what we're doing today? Another male high-def body contouring. The cool thing about this case is it's a primary one, meaning the guy's never had surgery before, doesn't have any scar tissue, irregularities, or indentations. We're just going straight from a perfect canvas to be able to make an amazing result. The other great thing about this patient is he doesn't have a lot of body fat, he's super athletic, and his skin is really tight. So what we're gonna get is an ultimate six-pack, an ultimate change. And the other really interesting thing about this is he doesn't have a uniform six-pack. He has a little bit of asymmetry to his abs, and you guys know I do natural abs. I do definition around the muscle that's there. I don't create a fake look. So in this case, we're gonna get much more contouring, much more natural shaping to the lower part of his chest, to all of his stomach, and we're gonna use the fat that we take out, and we're gonna graft it to his buttock to give him a nice soccer butt lift, or what we call the Emer hourglass. So high-def lipo, especially for males, incorporates a number of technologies and techniques. One is fat removal, where we use ultrasound to kind of steam heat the fat, get that fat ready for transferring. The second part will be internal heating with the Renuvion radiofrequency, the newest device to internally heat the skin. And then obviously we also physically remove the fat with a power-assisted device. The last part is the etching and the sculpting, and then using the fat to create a muscular look, which we're gonna use for his buttock. Another big problem area for guys in their 20s to 30s, and they start to notice that neck sagging and some fat that develops under the neck. A lot of the non-invasive treatments we have do just a little for removing fat and tightening skin. We're gonna use an internal radiofrequency device called FaceTite to really sculpt his lower jaw and neck. It uses heating to burn the fat, to melt it, to tighten that area, so we can literally shrink wrap everything and give him a more contoured jawline. So overall, we're gonna hit the problem areas of my younger males, the stomach and the sides and the neck. And we're also gonna give him the tightening. We're gonna use my Emer techniques to really develop a much more athletic and contoured look. And it's gonna be really straightforward and great because he doesn't have previous scar tissue or any irregularities, any problems from previous surgery. We're starting out from scratch to get an amazing high-def transformation. Here, he's a very athletic body and looks really good, but he has those problem areas that most men have in the flanks, in the lower stomach, and in the chest. So we're gonna use our techniques to remove fat in those areas, sculpt out the border of the chest, define the entire stomach, and then also remove those problem areas by lifting the buttock as well. We're gonna give him a nice athletic contour. We're gonna use different techniques such as fat removal, internal heating with Renuvion, and fat grafting. You guys, the key to any really good body contouring result is technique and being meticulous. You can't rush these surgeries. We're putting in the numbing solution right now that has some medicine in it to not only numb the area so when he wakes up he doesn't have pain, but also decrease any of the bruising, because there's medicine in here that stops the bleeding. It makes it a really easy and safe case for the patient. As the fluid builds up in the skin, You can see some swelling in the tissue and some whitening. The whitening tells us that the fat is ready to be removed. So you guys can hear the sound under the skin. That's the ultrasound technology that's kind of pushing away the fat cells gently so we can reduce the fat, help steam heat the skin, but also use that fat to lift his buttock. This gives us a better result with lipo shaping as compared to a non-energy based traditional lipo. So most men have problem areas of fat that they accumulate in the flanks, lower stomach, and chest. We've already done VASER in those areas. We're now focusing on bringing in his sides and slimming his waist with the ultrasound, and then we're going to use lipo techniques and internal heating to make it even more contoured and give him a V taper. Now we're doing power-assisted fat removal. This is the second step of how we do lipo. And this goes hand in hand with the ultrasound technology because we've now steam heated the fat to help tighten the skin and loosen the fat. Now we need to remove it gently so we can harvest it. This is going to give us the contour. We're not contouring the lower stomach, which is a big problem area for most men. And if we really want nice definition, we got to get this super flat. Still debulking, removing the main fat, but you can already start to see the definition coming in here. Take a look. We're creating the shape of the lateral abs and a nice squared off look of the chest. People call this the Gladiator procedure because they're creating a really defined torso. And you can see right now I'm sculpting it out. You see the top of his abs is starting to come in and really give a lot of definition. See here, squared off look. Internal radiofrequency plasma heats, shrinks, wraps the skin and gives us a tighter look. It also evens everything out at the end of high def to give us a finessed, contoured look. So doing some Renuvion tightening in the back will help give some contouring to the dimpling as well as the shaping of the buttock and tightening of the flank for the love handles. Fatten out of the buttock to give it some size and lift. Nothing too big for a man. We just want it more perky. It's going to look more blended with his new contoured on his back. So this actually adds a nice shaping to a man when they do the fat grafting. Hey guys, it's Dr. Emer. We're in West Hollywood and we're day one, not even 24 hours after doing high-def body sculpting. Remember I told you yesterday, if you were following, my excitement of yesterday's surgery was the fact that I had a young guy who already works out a lot didn't have previous surgery, so there was no scar tissue, indentations, or irregularities. Just had some problem areas of fat, specifically in the lower stomach, the sides and back, and the chest area, where most men tend to carry that, you know, especially if they have kids and they don't have a lot of time to go to the gym, or they work long hours. It's much harder to work out hard at the gym. So doing the sculpting procedure can allow you to get that contour back and then really make it at the gym afterwards. And after day one, it starts to swell up and you lose it a little bit, but you can see the contour along the lateral side of the chest and the center. You can, and the bottom. You can see all the six-pack being created. And the massage therapist is pushing the fluids off the lymphatic channels to help get it to not only drain, but also decrease all the toxins that are in there from the lidocaine that's in the fluid, anything from anesthesia. Definitely does not feel good, which is why we do IV hydration at the same time and then hyperbaric oxygen therapy. So overall, it's going to give him a quicker healing time, much less swelling, and we're gonna prevent scar tissue, seroma and hematoma, which is fluid and blood buildup as well, by doing this, so that we prevent any long-term complications. We want the best results. And you can see there's even not a lot of bruising, and that's because we do internal radiofrequency heating that coagulates the tissue and tightens everything, but also decreases all the bleeding. So he actually doesn't bleed that much. It's just going to be more swelling and prevention of long-term scar tissue from building up.
It's a Monday, and we have a patient here from last week, day 4, and we're still focusing on his lymphatic system and doing lymphatic massages, because we haven't got to the point to customize for him, because everything is great. The drains are draining, they're not plugged, the body's still defined, as we see all his abs and every part of his surgical areas are still defined. He hasn't swelled up yet, and hopefully he won't. So that's the plan for now. Just keep him as flat, as defined as possible, with draining the lymph through the lymph nodes. Here our hyperbaric oxygen chamber. As you guys see, it's a professional portable hyperbaric chamber. Pure oxygen helps with healing, applies pressure on the body, pushing the fluids out, helps with bruising. Just for the patient not to have too much pressure at once, kind of popping the ears and stuff. So we're gonna leave a little bit of air open here until it fills up. Then maybe like about 5 to 7 minutes, gradually I will be closing in, and then I'll close it up so he can get the full, 4 psi of pressure.
Hey guys, it's Friday, and I know typically we show a lot of fillers on Friday, but we're gonna show a fabulous fit body on Friday, a patient of mine 6 weeks post-surgery. I cannot even explain the number of patients who have asked, or people who have asked me about this patient specifically, and then a female patient we did last week. You guys keep asking over and over, where are they now? How do they look? They want to see the results. So I'm going to show you really quickly what this male 360 high def lipo looks like. He did sculpting of his abdomen, a lot of removal in his flanks and his back, and we do buttock fat grafting to give him a new shape. It's completely normal looking. Let me show you. So when we zoom in here, you can see how fit and athletic he looks. Nice lateral border of his stomach. We pinch, almost no movement in the skin. That's the Renuvion, that's the sculpting. You can see the sculpting of his abs. Here's his ribs. You can see the sculpting of the lateral portion. Squeeze as hard as you can. you feel this is his own muscle, you guys. There's a little bit of fat layer on top, but not that much. And down here there's swelling, but there's a normal amount of fat. That's what you want, because otherwise it looks very unnatural. So just breathe normally for a second so everyone can see, and then squeeze as hard as you can so everyone can see. It's awesome. Now take your left arm, bring it forward so they can see your sides. I want you guys to see, turn, his sides now and his buttock, because this is the key. A nice lift to his buttock. Almost no fat back here. You can see we're pinching, very, very minimal. And he's got an amazing sort of lift or soccer butt there. And if you take a look, it looks amazing from all angles. Let's go up top because you guys can see the little popping. You can see how much it's popping. It looks so good. And I always tell people, this is what you want. You want the little lift. Now squeeze your butt as hard as you can so people can see the little indentation on the side, the little lift up top, and then now rotate back towards me so they can see. Rotate back, stay right there, perfect. And that's it. Now turn the other way a little bit. Stay right there, bring your arm down. So now I'm gonna show them the other side, and here's where he looks great. Look, you can see the underlying part of his chest is coming in. You can see his stomach really getting defined. He said, someone wrote poppin' ass booty. That's what they wrote about you. Everyone's doing kisses faces. I wanna look like you. I wanna do this. I'm just trying to look, it's like a lot of people following. It's crazy. So ask him to twerk. Someone just said the person wants you to twerk. So here, you can see it. Look how nice it looks, guys. Nice and natural. They're gonna be so happy for Friday. So squeezing, and I just want people to see the natural abs. And then stand as tall as you can and kind of just like stand like a superhero. Yeah, exactly. Because this is where you can see flat, so flat, defined, and tight. All along the rib margin. Look, almost no movement in the skin. So all he needs to now, all these women are saying, perfect beast body, I want to marry him. Oh my God, ask him to twerk again. It's hilarious. All right, well, so you guys saw, that's a great result for HD-Lipo. He's doing great. The goal now is 3 things. Hormonal therapy with Dr. Jill, hormonal optimization, eating right and exercising, and then doing at-home compression. And then the third thing is in-office body treatments like radiofrequency or magnetism like TrueSculpt Flex. So we will show you those as we go, and in about 12 months, he's gonna have the Brad Pitt and Fight Club looking body because his body's gonna be so tight. He didn't have a lot of body fat before. They're asking about that. He did have some of his stomach and sides, which we removed to give him a buttock, and we did a lot of internal tightening so that as the months go on, it will shrink in and look even better.